Hello and welcome to another segment of anatomy tutorial. In this case, we will be talking about the vertebral column again. And a few other things. So here is a child and an adult, and you can see that the vertebral column in a child only points one direction, curves in one direction posteriorly, but in an adult or as a child grows, and there's two new curvatures. So this is the primary curvature, and it's two secondary curvatures appear, and that is the cervical and the lumbar. So the cervical, when their head they raise their head and they start using their neck movement, and the lumbar curvature develops as they start to walk on 2 feet. So here is another picture of the vertebral column, and you can see the curvatures, the cervical and lumbar being the secondary curvatures because they develop later on, and the thoracic and sacrococcygeal, they're the primary curvatures. They were also the kind of curvature that was present even before birth and early childhood. These here are examples of different types of bones. So you see this is an example of a long bone. There's an expansion and a shaft. The bones of the fingers are also examples of long bones and also the metatarsals and metacarpals, they're also long bones because they have a shaft and their ends are expanded. Expansions on the ends and a shaft. All of these are long bones. Short bones are, for example, here in the wrist. They're not really flat, they're rounded and they're short because they appear like this. They're short. Okay? Then you have bones, flat bones, bones that make up the skull, for example. These would be the flat bones, and we will get to bones of the skull later. You have irregular bones, like the bones of the vertebral column. There, as you can see, of course, you can see how they're irregularly shaped. And you have sesamoid bones. Sesamoid bones are like the patella and the two sesamoid bones under the head of the first metatarsal. These sesamoid bones, they grow inside tendons. Okay, we will get to that later too. Here is an example of different types of joints that are present in our body. So here, for example, these are the common ones. A hinge joint, for example, present in between the phalanges of our toes, of our fingers, and toes. They are and in other places as well. So the hind joints only allow movement to be flexion, extension, like so, only in this direction. Like you can see, I cannot make it go left and right, only forward and back, flexion, extension. That's a hind joint. You have a gliding joint. By the way, these are all synovial joints. So these are different types of synovial joints. Gliding, very common. It just means that one surface glides on top of another. So like my hand on paper, gliding. You cannot really, it's not flexion, extension or anything, just gliding. So it would be present here between these bones of the wrist, as well as between the adjacent vertebral bones. Then you have here, this would be a pivot or pivot joint. A pivot joint, like you saw in the atlas axis, atlantoaxial joint. I'll show you that in a second. So remember the pivot joint, I'll show you that in a second. And this here is a ball and socket. So we saw humerus and the femur, they articulate with the scapula and pelvis respectively in that order. The ball and socket allows all kinds of movements. So ball and socket would be between where my knuckle is and where my finger starts. So that's where I can do all kinds of movements, left, right, flexion, extension, circumduction, circular movement. And finally you have a saddle joint. Saddle joint is only present in the thumb, not this portion of the thumb, but at the base of the thumb. So I'm right where I can't point with two hands because I'm holding the camera, but if you can see where the pen is pointing, my pen is pointing in this area, so that's where I can do this, a saddle joint, and allows great movement of the thumb. The other fingers do not have that kind of movement. Saddle joint allows much greater movement than the other fingers.